I'm sure some of you have hopefully worked with the networks previously, and apologies to those who might be used to the content of my slides. I have used them a few times in the Yorkshire Humber network and on these calls previously, but hopefully the new folk on the call will hopefully benefit from what you're about to get, and there are some new little bits, new tidbits to keep the folks who've seen it before engaged. So hopefully you're aware that the NIHR are here to support health and social care research delivery now in all sites inside and outside of the NHS, and we do this by funding research delivery support, funding an infrastructure within the CRN called Study Support Service to help sites set up and performance management of studies, and I'll go into a little bit more detail around that in a second. So, there are 15 networks, but I suppose this conversation pertains to the 4. We do collaborate a lot as networks, so the Northern networks. We do operate super networkly in quite a few different scenarios. So we're here, so if you're thinking of a study, we're very, very close to talk to each other. We can collaborate with each other. We can help you set up studies in not just in our local networks, but in other ones as you see fit. And as mentioned previously, the NIHR CRN was primarily focused on research delivery in the NHS. But as of 2018, this scope of support was expanded to support public health and social care research. So basically any studies taking place outside of the NHS could be supported now by the CRN. And just to clarify what that level of support looks like, there are differing messages and different arenas around CRN support outside of the NHS, but this is taken from our guidelines. And I just want to show you the lines underlined at the bottom. NHS support or the equivalent to NHS support in non-NHS settings can be provided for attributed activities as defined by a code. So, areas of CRN support generally, so database search, eligibility check, consent, all these elements are CRN support activities and therefore can be supported in non-NHS sites. So I suppose a good example there would be a care home or a third sector charity or a local authority or a school being utilised to identify participants for a study. They're screening that list of participants, they're identifying folk and ensuring that they're eligible, meeting the criteria of your study. That is a CRN support activity and therefore can be met by the network. So I would go along with previous conversations you've heard today. Please contact your local network as soon as possible if you think this aspect of delivery will be utilised in your application. Also, as of this year, each CRN is being given funding to primarily support health and social care research in non-hospital settings. So this ensures that all the LCRNs will have greater flexibility in delivering. And as you can imagine, that money is now being utilised now, that infrastructure is now being set up. So therefore, when your study becomes live, that infrastructure will be there to support your study. So again, please do talk to your local network about how this can be built into your application and how this support can be given to your study so it's successful. So you've heard the dreaded word accord, and I'm not quite 100% sure, but I will presume you may be asked for the schedule events cost and attribution tool, the dreaded SOCAT. Again, the networks are here to support you with that. We will guide and help and work with your R&D colleagues, your university colleagues on helping the completion. There are learning tools available that we've designed to support this. There's training on our NIHR Learn website around Accord and around the SOCAT. Please don't hesitate to get in touch with your local network and ask for details around this. We're more than happy to help. We're more than happy to do what we can to make sure that you're successful with these. Again, good example, care home network. So if this does, if you are thinking of this domain of carry on research, we have our enriched care home network. Each network has multiple homes that are signed up and are research ready and ready to be engaged in studies. So again, if you're thinking about going down a care home route, it's worth talking to your network. Can we get some of those enriched care home managers to be involved in your study? Can they provide any advice, etc.? Mentioned about the study support service. They're there to guide you through the study from start to finish, working with their colleagues and their management teams. So again, you know, you're on the early contact stage now, so you've got a study design. How can the network help with the delivery of your study? So it's worth having that conversation now. If we can be involved, you know, what do you need identifying where your participants coming from? Can we help in any way with that? Just drop us an email, have a conversation. We might not be able to, we might be able to, and then it's better said than done. We can help with study setup. You know, if you're thinking multi-centre, if you're thinking multi-network, we can liaise with our colleagues on other networks and help through that. We can help with the performance monitoring aspect. You know, you're 6 months into your study, you're not meeting your milestones. What can we do to help? Can we help you open new sites? Can we talk to other networks to open new sites? What can we do to help you support that study deliver? PPI, each one of our networks has a significant PPI set up. And I know they're in universities, they're in local authorities, there's so much to choose from in this angle, but of course the relevance is of valued importance from the idea to the dissemination of your study. So if you do need any assistance with PPI, we're very happy to help. We have our own network as well, but there's so much out there. And if you need collaboration from a professional in the non-NHS arena, please don't hesitate to get in touch. You know, do you need to talk to a third sector charity about them being involved? We're very happy to have those conversations as well. Each network has differing offerings that they can help. There's a little bit more that, local initiatives, shall we say, that go on. For example, in Yorkshire and Humber, we have, in each local authority, we have a research link. We have a 0 to 19 network, which is school visitors and school nurses and health visitors. Again, very happy to have conversations with people around feasibility of studies and, is the data capture paperwork right? These little small things, they're very happy to feedback. We have the care home network, as previously mentioned. We have our deep end network. This is a cluster of research active general practices in areas of deprivation. So they're primarily linked and they're very research focused on providing research to the communities of deprivation. So they'll be very happy to have conversations if anyone's pursuing that line. Of course, I've already mentioned we've got our research delivery support mechanisms in place. Some of it's got legacy around that already, but all the networks now are now building on that. We'll all have this support in place for you to help. A little bit of a quote from a PhD researcher we supported with a study at the bottom. And lastly, contact details for the 3 networks. Again, they are all very happy I've approached. They've all been approached. They all know what I'm talking today to you, and they're all ready to receive any queries that you might have about what CRN support is needed. Now they can help you with that, the dreaded SOCAT, etc. Thank you very much.